Morning, Lillian.
Hi, good morning.
Hi.
So we understand you're very, very busy, but just wanted to kind of get an update on some things at the hospital.
I thought all of this media is supposed to go through Jim.
Yeah, Lillian, but you called us the other day unprompted, so we're just trying to get the people that we feel like the people of Guam need to hear from, and there's just a lot of runaround with the jig, so we're trying to go direct to the source. So we do have, yeah.
Wait, I did not call you guys. You guys called me. I don't call you guys.
Right, we called you, and so we're hoping that we can get any sort of an update on what's happening at the Guam Memorial Hospital. In particular, we've asked the question during press conferences regarding what is the plans, or if there are in fact plans to move the pregnant women and babies over to GRMC, the COVID-free hospital.
Okay. We'll begin with that one. And as I said at the governor's conference, press conference yesterday, there has been no agreement, no definitive decision at all to move the MCH services over to GRMC. It's just discussion to see how best we can, continue the provision, the delivery of MCH services to the MCH clients on island. At the same time, continue to manage the, individuals who need to be treated for either POI or COVID. So right now, we are managing it, we are handling it, and we're dealing with it, and we are minimizing as much exposure to the MCH population. So right now, we don't need to move them, and so there's no agreement, there's no decision. We still continue the services here.
There was something that Dr. Mike Cruz mentioned during one of the press conferences, though, that, like you said, there are discussions, and there's been tours, I believe, that have been conducted. I know Dr. Shea was on our program earlier, and he mentioned, and he's the head of OB, right, over at GMH. So there's tours that have been conducted over at GRMC?
Well, there have been, and not only for MCH, there have been tours from the very beginning, because we also talked about moving and transferring the SMU patients over to GRMC, and that did not happen because it was just too complicated of a process. It was just extremely complicated, and so we needed to move fast. So then the quickest and the most effective way and safest way and less complicated, we moved the patients over here to our acute care facility. And so that's what we did. So, again, it's an extremely complicated, especially maternal child health. You've got 4 different specialty units: labor and delivery, the OB nursery that includes neonatal intensive care unit for the neonates. We've got the postpartum area, and we've got the pediatric unit that also includes pediatric intensive care unit. So those are 4 specialized maternal child health areas that, to move them, it's an extremely complicated process, and it's going to take a lot of, thinking into it and the details to make sure that we do it smoothly. And it's going to take time. We don't have much time.
Right.
So we're dealing with it. Go ahead.
Go ahead. No, I just wanted to ask. I know it's complicated. You're saying it's going to take some time, but are measures in place to keep, the COVID-19 stuff over maybe on that side of the hospital? And I mean, just people want to know: are expectant mothers, pediatric patients, are they safe from exposure?
Right. Absolutely. That's the one thing that we want to make sure is minimize the exposure. And we have a process, and I know Dr. Shea, in his wisdom, is trying to, help us out. But his suggestion to have these pregnant mothers come through the front is not feasible. It's not safe. We have a process that we have instituted about 2 weeks ago, 3 weeks ago, when we started having the POI individuals come in. And so, therefore, we are, again, making sure that we minimize their exposure when they come in laboring and ready to deliver. We minimize. We moved the pediatric patients to an area that minimizes that they don't have any patients who are COVID or POI in that area. Nursery itself, OB nursery, they are in an enclosed and a confined and secured area on the second floor, away from the COVID care area that we have opened up for these POI and COVID-based individuals. So, yes, absolutely, we're making sure that they are protected, they are safeguarded, and they are the exposure is minimized.
Well, we certainly thank you for providing those reassurances to the community.
Okay.
Lillian, thank you so much. I wanted to just ask, so we're doing the limited COVID-19 testing for priority groups. And again, we've gone over this the last few days. Those include a lot of people, maybe in ICU, GMH, elderly patients. Do you know what the results that we got last night? How many of those were fit into the different categories of the priority testing? Do you know? Do you have that info?
You know what? I don't handle that. It's public health who makes that determination, and they have a criteria. And they work with a team of physicians establishing that criteria. So it's not just public health sole decision and sole discretion. It's a team of doctors that they work with. Right.
So I guess, I mean...
We've asked that, they give GMH and GRMC priority because, they're in the hospital, and we need to know whether or not they are positive or negative.
Correct.
So that we can then take the appropriate direction. Because if they are negative, then we can move them out of the, COVID areas or the care one. That's where we keep the individuals who are PUI. And so it helps us with the flow and the direction of where we can then get these patients to.
Right. And so I guess you might not know where they are, but do you know if they have finished testing everyone that fits the criteria at Guam Memorial Hospital?
Yes, they have. They certainly have.
Mm-hmm.
Okay.
Do you have any results? I know the last time we spoke with you, you had mentioned and confirmed the one patient that came in with for other complaints aside from being the flu, and but he was hospitalized anyway. I believe on the 3rd floor in a private room, and then it later turned out that he through a radiological screening and so then he turned out positive for COVID, and you were conducting an investigation to determine how many health medical staff had contact with that individual, and if they exhibited signs or symptoms, they were going to be tested. Do you have any latest information on that?
Absolutely, yes. All the 3 nursing staff who were considered high-risk exposure because they were in direct and a personal up close and personal contact with the individual, with the patient, and so those results came back, and they're all negative.
Oh, thank
goodness!
We're
very, very pleased that again, no exposure to those individuals who were considered high risk. So it's a big relief, and it shows that people are really very cognizant and making sure that they minimize or they at least try and protect themselves. With hand washing, with at least face mask, and what CDC guidelines says that even if they're not in an isolation room because we don't have it, but at least in a private room. And so it was evidence that what happened certainly worked out.
Well, that's good. We're glad that you guys take the precautions, and it looks like in this instance those precautions worked out for the better.
Yes, it certainly did. And so again, it's evidence that people who are concerned, who are anxious of the exposure, if it's a low exposure, even just walking by the room, you're low exposure. So, just again, alleviate that anxiety and that fear.
Mm-hmm. How many people, COVID positive patients, do you have currently at the hospital?
You know what? I had that number, but it's on my phone because the nursing supervisor, we're right now in the care one, which is our PUI area, individuals who are categorized as PUI, waiting for test results. There are 5 individuals in there. In our 4th floor, care 3, that's where we have all the COVID positive patients. There are 7 there. Then up at SMF, we transferred 2 yesterday who, met the criteria of being afebrile, no fever for 48 hours, no need for oxygen for 48 hours. So there are 4 now up at SNF.
Okay. Is there anything else that you wanted to get out to the community?
Just to continue the social distancing and the hand washing and, protecting, minimizing as much as possible the spread of this condition.
Lillian, we also know that there were several efforts out there to give donations to doctors and nurses at the hospital who, are stretched so thin. We're hearing, people doing double shifts and all that stuff. Is there a way that we can have the public, show support for the staff at the hospital and the healthcare workers, but still kind of adhere to the social distancing and all that stuff?
Right. Well, we've been really blessed because many eateries and many restaurants have been donating meals to our employees here who take care of the COVID patients and up at SNF. So we've just been really very fortunate that, these companies, these businesses, these restaurants have been very gracious in providing the meals. There have been organizations, alumni associations who are also getting donations to procure some PPEs that are a little bit more costly but very good, high quality PPEs. So again, it's great. The community is just wonderful coming together to really help us get through this, and we will get through this.
Well, thank you, Lillian. We're praying for you guys over there, and I know you're so busy, and thank you for your time. We really appreciate it, Lillian.
Thank you too.
Take care.
Okay, Esther.
Yeah.
Yeah.
Okay. Bye.
All right. Thank you so much, Lillian Posadas. And hey, I'm
She
not
just
gonna,
took our call.
Yeah,
We
I'm
called
not
her
gonna-
up. We just wanted to get an update, and she provided that. So
Yeah,
we really
so thank
appreciate